AAAM AIS CAISS Head Exam. Question 1. How do you code a through and through gunshot wound, GSW, to the skull? 116,002.3 less than 2 cm penetration. 116,004.5 greater than 2 cm penetration. However, if you know more details to specific organ damage, this cannot be used. Code only the entry wound. Code as a scalp laceration. 116,004.5 greater than 2 cm penetration. However, if you know more details to specific organ damage, this cannot be used. Question 2. In a penetrating injury to the head, if the skull is not penetrated, how do you code the entry? Code it as a brain contusion. Code it as a mild concussion. Code it as a skull fracture. Code it as a scalp laceration. Code it as a scalp laceration. Question 3. Which statement is true regarding cranial nerve injuries? They can only be diagnosed with an MRI. Cranial nerve injuries may be described only by the type of dysfunction that exists in the normal nerve activity. They are always coded as a severity 5. They cannot be coded under ACE. True, cranial nerve injuries may be described only by the type of dysfunction that exists in the normal nerve activity. Question 4. For cranial nerves, how do you code total loss of nerve function, paralysis, and partial loss of function, paresis? Code total loss as a contusion and partial loss as an abrasion. Code both as a laceration. Code total loss as a laceration and partial loss as a contusion. Code both as a concussion. Code total loss as a laceration and partial loss as a contusion. Question 5. What are the first 6 cranial nerves? I. Olfactory, 2. Optic, 3. Oculomotor, 4. Trochlear, v. Trigeminal, 6. Abducens. I. Optic, 2. Olfactory, 3. Facial, 4. Vagus, v. Abducens, 6. Trigeminal. I. Vagus, 2. Optic, 3. Oculomotor, 4. Facial, v. Trigeminal, 6. Auditory. I. Olfactory, 2. Oculomotor, 3. Optic, 4. Trigeminal, v. Trochlear, 6. Spinal accessory. I. Olfactory, 2. Optic, 3. Oculomotor, 4. Trochlear, v. Trigeminal, 6. Abducens. Question 6. What are cranial nerves 7 to 12? 7. Vagus, 8. Facial, 9. Optic, X. Auditory, 11. Spinal accessory, 12. Hypoglossal. 7. Facial, 8. Auditory, vestibulocochlear, 9. Glossopharyngeal, X. Vagus, 11. Spinal accessory, 12. Hypoglossal. 7. Trigeminal, 8. Facial, 9. Vagus, X. Auditory, 11. Hypoglossal, 12. Spinal accessory. 7. Facial, 8. Vagus, 9. Hypoglossal, X. Auditory, 11. Spinal accessory, 12. Glossopharyngeal. 7. Facial, 8. Auditory aka vestibulocochlear, 9. Glossopharyngeal nerve, X. Vagus ** excludes injury in neck, thorax, or abdomen, 11. Spinal accessory, 12. Hypoglossal. Question 7. What is on old Olympics towering tops? A Finn and German viewed some hops used for. To remember the bones of the skull. A mnemonic to remember the cranial nerves. A scale to measure consciousness. To classify the severity of brain bleeds. It is a mnemonic to remember the cranial nerves. Question 8. Injuries to internal organs such as the brain stem, cerebellum or cerebrum must be verified by CT, MRI, surgery, X-ray, angiography, or autopsy. True. False. Only in pediatric patients. Only if loss of consciousness occurs. True. Injuries to internal organs such as the brain stem, cerebellum or cerebrum must be verified by CT, MRI, surgery, X-ray, and angiography or autopsy. Question 9. Which of the following are parts of the brain stem? Cerebrum, cerebellum, and frontal lobe. Hypothalamus, medulla, midbrain, pons. Thalamus, pituitary, and pineal gland. Hippocampus, amygdala, and cortex. hypothalamus, medulla, midbrain, pons.